Good afternoon, everyone, and welcome. Just bear with us a minute or so while we wait for everyone to arrive, and then we'll start the webinar formally. Hi, everyone. If you've just joined, we're just waiting for people to join us. We'll wait probably about another 30 seconds, and then the board chair, Rowan Cochrane, will start the meeting formally. So just give some people a moment in case they're running just a moment behind. I think people arriving have slowed down, Rowan, so up to you. It's after 2 o'clock now, you might like to start.
I think we will start. Just people have a busy schedule in any given day. So as people join in, we'll just start the meeting off. So let's move forward. So good afternoon. It is where I am. I am Rowan Cockrell, and I'm Chair of the Consumers Health Forum of Australia. Firstly, I'd like to acknowledge the traditional custodians of the lands on which we're living and working today, and their continuing connection to land, water and seas. I am on the land of the Wurundjeri people of the Kulin Nation and pay my respects to their elders past, present and emerging. I also pay our respects to any First Nations people here today. I will introduce people on the panel in just a moment, but I thought we'd just also put up CHF's consumer recognition statement, which you can all see on your screen at the moment, but just the intent is respecting the lived and living experiences of health consumers, carers and families and communities across Australia, and recognising that every person should be able to get equitable access to healthcare regardless of their background and circumstances. We do live to value the experience, lived experience, expertise and personal commitment of consumer health advocates working to influence change. They make a big influence on that, and we seek to elevate the voice of those who have navigated the complexities of the health system and partner with them to drive meaningful and inclusive change. So just to talk about and that slide can stay at the moment, just to talk about the theme of the webinar of why being a director of the CHF Board. And this is just an information webinar to sort of share some information in anticipation that there will be people who would like to consider this a role on the board. So the board will be advertising nominations for elections later this year, and this webinar is an opportunity to understand what the CHF board is looking for in skill sets, and also to understand a basic understanding of expectations of commitment should you wish to nominate for a position on the board. I would like to thank all current board directors. You've got Louise Hardy, Deputy Chair, who's on the panel. And Scott Harlan, Chair of our Governance Committee, both who will be speaking shortly. Thank you. My thanks goes to David Blair, Chair of our Finance and Audit Risk Management Committee, but who is unable to attend today. And also Lucy Clines, Gloria Jacob, Min Nguyen and Christine Walker, who are not visible as on the panel but are attending today. So thank you. I'd also like to thank Elizabeth Devaney, our CEO, who is on the panel with today, and all the work that goes behind these webinars and the effort to put into to get to where we are. So thank you to everyone. Just to say that if there are any questions, please use the chat function, and we will take some time at the end of this session to answer any questions that we can, and we'll come back to you. So just please add them to the chat and we'll keep an eye on them. Okay, so about why be a director on the CHF board? So, and who are we? So the Consumer Health Forum of Australia, or CHF as I'll probably say most of the time, is the national voice of the health consumers. This year marks 40 years for CHF, with the organisation first funded in 1986 to 87 federal budget. And you can see our little logo down there. We're very keen to celebrate that in this coming year. The work began with Minister Neil Blewett, and I'll refer back to his words, which were meaningful then as they are now. Minister Blewett said in his speech to CHF, "Without informed and knowledgeable and articulate health consumers, health policy will always be unbalanced, whatever the goodwill and idealism of governments and health providers are. Mature consumer organisations are an essential part of health." And as you can see, this really does ring true today. Since then, CHF has continued to shape Australia's health system by ensuring that consumers have a seat at the table. CFA works across every part of the health system. We bring the voice of consumers, people using the health system every day, into health policy and reform conversations. We are independent, non-government, funded through the Federal Government of Health, Disability and Ageing as one of its key health peak body and advisory bodies. We're recognised as the peak national organisation for health consumers, with over 80 voting and organisational members and over 50 individual members and a growing number of life members. CHF engages with our members through our policy network, our members' research network, and in our day-to-day work. Building on our engagement journey, we also collaborate closely with consumers through the inaugural Consumer Assembly, which includes 20 consumer representatives from across Australia. So what's different about being a board director? For those who have not been on a board before, being on a board is different from working in a staff role, from being an advocate, or from serving on a committee. It involves a distinct set of governance skills like understanding fiduciary responsibility, financial oversight, risk management, and long-term strategy. Directors are legally and ethically accountable for the organisation's health and integrity, and that's why it's not a role to be taken lightly. At CHF, we welcome people with a wide range of backgrounds. You don't need to be an expert in governance to begin with, but you do need to come in with a willingness to learn and gain some grounding in strategic thinking and responsibility. We support new directors with induction, peer learning, and ongoing development. But that foundation of understanding of what it means to govern, not just advise or advocate, is essential from day one. So what does the board look like? CHF has a skills-based board of up to 9 directors. Some are elected by our voting member organisations, and others are appointed by the board to help balance the skills and experience that we need. Directors bring in a mix of capabilities, including consumer engagement and participation, health policy and systems, health service and management, patient safety and quality, medicines and health technology assessment, Medicare and private health insurance, finance, law and governance, and strategy. Terms are for 3 years with a maximum of 2 consecutive terms. So what is the work of our board? The board sets CHF's strategic direction and ensures that the organisation remains financially sound, well-governed and future-focused. Meetings are held up to 6 times a year in a mix of virtual and face-to-face formats. That rhythm allows time to engage with members, stakeholders, and senior leaders in health, including ministers, the Department of Health and Ageing, and the sector partners. The board also plays a key role in reviewing its own effectiveness and composition, ensuring we remain fit for purpose. We have two standing committees, governance and finance audit risk management, and sometimes we form short-term working groups when needed. CHF is a small organisation with a small board, so board members are expected to contribute on one of the board's subcommittees as well as being attending the board meetings. Board roles and subcommittee roles are voluntary, and there is no additional payments for committee work. Since David Blair, Chair of Finance Audit and Risk Management Subcommittee, can't be here today, I will give a brief overview of that. And just to say that we shorten Finance Audit and Risk Management to FARM, but this is the same committee. This committee's role is to keep close oversight of CHF's finance audit risk processes and audit processes. In practice, that means we review monthly finance reports, work with external auditors, and keep monitoring the risk register, risk appetite, and risk tolerances. It is one of those committees that does a lot of quite important work in the background. The aim is to make sure the board has good information, clear advice, and appropriate assurance before decisions come forward and are made. The committee meets 6 times a year, usually every couple of months, aligning with the financial needs of the organisation, and for a 90-minute virtual meeting each time. And then there will be a requirement to read the papers prior to that meeting as well. I'd like to introduce Scott Harlam, who is the chair of the Governance Committee, who will give a brief overview of this committee.
Thanks, Ryan. Good day, everyone. Scott, the chair of the Governance Committee. Our role as the committee is to ensure that is to help the board maintain strong governance across the organisation. What that means in practice is that we review a range of governance documents before they go to the board. That includes policies, procedures, governance-related materials such as the nominations policy for board elections, the board, other board policies, important ones like the privacy policy or the whistleblower policy. The committee doesn't make decisions on behalf of the organisation or have on behalf of the board. That's reserved for the board, but we do make recommendations to the board, and we do that detailed engine room, if you like, work around governance that the organisation and the board relies on. It ensures that when work goes to the items of business go to the board, the full board, that they've had a detailed consideration at the committee level, and they don't require that sort of great bulk of time that the committee puts in at the board level. As the committee, like the Farm Committee, meets 6 times a year, usually every couple of months, and it's 90 minutes and virtually. As Rowan said, the CHF is a small organisation, and as a director, you'd be expected to join one of the 2 committees. I think governance is much more fun and interesting than finance and audit, I've got to say. So when you're asked if you're a successful nominee, when you're asked which committee you'd like to join, you will say Governance Committee. I assure you a much better time than in finance. But of course, David's not here, so that's all a bit rude of me. Governance can sound a bit procedural and a bit dull, but it really does matter. Good governance helps the CHF stay clear, accountable, and trusted, and these are essential things for an organisation whose role is to speak up for health consumers. So, thanks for joining us.
I just checking my speaker was working. I would say both of those subcommittees make recommendations to the board, but they're there to support the board, reduce the workload at board level to make informed decisions. So, but neither committee makes decisions instead of the board. That's really important to know. So what does our secretariat look like? So our staff team is around 20 people, working under the leadership of Elizabeth Devaney, our CEO, and has 4 directorates: finance and corporate, people and culture, advocacy and engagement, and policy and research. I'd like to ask Elizabeth to just give a bit of an overview of what's happening over operationally with CHF.
Thanks, Rowan. So I've got a few minutes to talk about what we're doing. I could do it probably in a few seconds. The short answer is a lot. We're a small organisation and consumer experience is relevant in almost every part of the health reform that's occurring right now. So we find ourselves at a lot of tables and with a lot of opinions because community doesn't have one view on health reform, it has many. A major focus for us is strengthening Medicare. This is one of the biggest reform agendas in the health system and relates to the primary care system. And our job is to keep bringing that conversation back to what people experience when they try to get care. We do that a few ways, and one of the tools that we use a lot is the National Consumer Sentiment Survey. And I might ask Emma or Elle, if you don't mind, just popping a link in the chat to the survey for people who haven't read the reports. This survey gives us a national picture of what Australians are saying about access, affordability, confidence, and actually their personal experiences of the primary healthcare system. It really matters because often what governments get is widget data. How many services? How many places did this happen? But what it doesn't get is whether people could afford the care, they understood their options, how they felt when they got the health care, did they feel respected, did they feel that they were included in the decision making? And this survey fills that really important gap. We're doing other things too, our focus groups and consumer engagement, all kinds of pieces of work to strengthen the Medicare reform process. But we're not just looking at these big national numbers, we're also listening to people and we're bringing it all together in a way that government can easily digest it. Another really important part of what we're doing is our Consumer Assembly, which Rowan mentioned. That's a group of 21 consumers who've been working with us across a whole lot of different projects. It helps us test ideas, co-design approaches. That lived experience statement you saw at the start, that was designed by our Consumer Assembly. It's really important because health policy often sounds quite tidy and even doable until it actually meets real life. So having that Consumer Assembly helps us road test policies, another way of us doing that. Research is also an increasingly large part of our work. We've been working for the last few years with the National Health and Medical Research Council on the updated joint statement on consumer and community involvement in health and medical research. It's just recently been announced, and again, that might be a great link, Al or Emma, to pop in the chat if people haven't noticed that that's now come out. This matters because consumer involvement in research is not a decorative extra, of course. It's meant to shape how the questions are asked, the way the research is designed, and how the findings are used. So we've been working on that as well as a range of other pieces of research with different community and research partners. So with Monash, we've been looking at healthcare costs and inequities. With the University of New South Wales, we're working on a toolkit for independence. And we're also part of a large primary health research collaborative. We've been involved with another university in some work on stigma, lots of different projects. Increasingly, I think that CHF sits at the intersection of policy, research and lived experience, which is a really important place for us to be. And our job, of course, is to make sure in all of these environments that consumer perspectives are not tacked on at the end, but rather forming the decisions at the start. We also work with national agencies and statutory authorities like the Australian Digital Health Agency, the Therapeutic Goods Administration, the Australian Commission on Quality and Safety of Care and Healthcare, the Australian Institute of Health and Wealth. I mean, it's a lot of different organisations. And we're asking them the same questions. Depending on what's happening, do consumers understand what's happening now or what's changing? Are they being given a seat at the table to help develop the changes? And when the changes land on the ground, do people understand them? Can they use them? Are we hearing from the people whose voices are most likely missed? And the other part of our work that's pretty visible is our advocacy and our public commentary. So you might have seen CHF in the media. Recently, we've done some work on dental care, on specialist costs, on medicines and medicine access, on private health insurance, and also just the broader affordability crisis that people are experiencing. And I don't really want to be in the media. I'd be happy to never be in it again, to be honest. So we don't just comment just to be in the media. We comment because consumers are telling us these issues affect whether they can seek care, whether they're delaying care, whether they miss out altogether, whether they're healthy. So sometimes that means I'm out there saying that this thing the government, any government or any organisation is doing is good because we've heard from consumers that they like it, and I'm saying we want more of this. Sometimes it means saying this is terrible and saying that we don't support a government policy change or initiative because consumers are telling us it's not working for them or it's not what they need. So yes, as I said at the start, we're doing a lot. I've mentioned a few of the things we're doing, but I think the thread that kind of runs through it's pretty simple. We listen to consumers, we turn what we hear from them into credible evidence, and then we take that evidence into places where the health decisions that matter to you are being made. And really that's the work that we do here every day. Thanks, Rowan.
Thanks, Elizabeth. And I would say the team and Elizabeth do a fantastic job. I know Elizabeth doesn't necessarily like all the media attention, but it is attention and it is showing and shining a spotlight on, you know, the point we're trying to get across all the time. It's our story and we need to share it and make sure that we're heard through the process. So I thank her for all the times and probably the different times of day and night that you have to attend media opportunities. So that's great. Okay, so I thought just before, we'll be asking Louise to talk in a moment, but I thought I'd just share with you just a little bit about the skill sets that we're looking at. So I might have that slide, Al, is so noting the existing skills that the board already possess. We have key attributes for potential board nominees to consider when they're looking at their interest in coming on the board. And these attributes have been agreed by the whole board. We review our skills matrix regularly, every year actually, in order to make sure that when we're putting out any expressions for nomination for AGMs that we're getting the right skill set to complement what already exists. I would say that we've had a turnover over the last 2 or 3 years where we've lost some long-term members and of the board, and we've got 2 more. Our 2 longer-serving people are leaving this year, which includes myself and Christine Walker. But we're very confident that the members that have been joining over the last couple of years and into this year will have a lot of strength. And so the change is good. It's refreshing the board and refreshing how we approach things. So, but it's really important to consider what we're looking for. So as this slide says, the attributes are not mandatory, but it's something to consider. And you'll certainly, if you have an interest in joining, it will be spelt out when a nomination pack is sent out if you express interest. So we are looking for a strong governance experience as a possibility, which might include prior board roles and or formal governance training with the Australian Institute of Company Directors. We have attributes where we're also interested in seeking commercial capability, including fundraising, philanthropy, business development, or broader commercial acumen of any one of those. It doesn't have to be everything. We have an interest in technology expertise, including cybersecurity, privacy, and IT. Excuse me. We also have a real interest in AI capability or a strong understanding of emerging technologies. And I think that we're all in agreement these things are influencing and impacting on business now. So it's good to have some of that expertise in the board as we move forward. So there's some of the areas that we're quite interested in. I might ask for the next slide, Elle, if you could. So these are the other perspectives that we're looking at that we think sort of have an overlay over some of the quite specific skills that we mentioned in the previous slide. So, a diverse lived experience and identities. So Aboriginal and Torres Strait Islander, LGBTI plus, the culturally and linguistically, I told you I'd have a problem with that, linguistically diverse communities, disability. So the real diverse board is what all boards should be moving forward into in how they do the process. But as you could see, it would help us also to strengthen representation when we're looking at the pieces of work that we're involved with. Understanding CALD communities and including that cross-cultural awareness and inclusive engagement is really important. A commitment to equity and inclusion and a focus on safe and respectful environments, and an innovative future-focused thinking and openness to new approaches, and collaborative mindset with the ability to contribute constructively to group decision-making. And I think that's fundamentally where the board sort of works anyway. Those last 3 points is you're not bringing your own agenda to a board such as this. You're bringing your expertise to be able to help a collective future-focused positioning for the board makes it a very strong board. So they're the lived experience and diverse perspectives that we're sort of hoping to see in nominations this year. All right, thanks, Elle. So I'd like to just hand over to Louise Hardy, my deputy chair, our deputy chair, and she's got 2 areas that she's looking at the moment, and that's looking at eligibility and pathways to nomination and funding and independence and policy positions. So Louise, just to move through those points as you can.
Yep, thank you, Rowan. And hi, everyone. Thank you for joining, and great to see so many people on the line and some familiar names. So I'll take you through the eligibility and nominations processes. In terms of who can apply this year, the vacant positions are member elected positions. So that does mean that candidates need to be nominated by one of CHF's member organisations. And we can put the link in the chat for anyone who's not already got a connection there. So you have the opportunity to perhaps reach out to a member. And if you are interested but not currently involved with the CHF member organisation, you will have to contact them directly and have that conversation with them in terms of whether they would consider supporting your application. In terms of the membership requirements and endorsement, as we've just said, obviously CHF's members are central to our governance. And so that's the reason why these nominations do run through member organisations. And they may each have their own processes around nomination. And that could involve potentially speaking with you or interviewing you or seeking approval through their board or committee. And so for that reason, obviously, I think the sooner the better in terms of getting in touch, and definitely not leaving it until the last day, because that would probably be a bit too late to really facilitate that. In terms of the sort of paperwork and the probity checks that are involved, once the member organisation agrees to nominate someone, the candidate will need to complete CHF's nomination paperwork. And again, I'm sure those links will be provided and on our website. So that'll include a confirmation from the member organisation that they are nominating you, as well as a photo and a short bio. And that's so that the voting members can understand who you are and why you want to join the board and what you would be bringing to the board. And we also need, obviously, you to demonstrate that you are eligible to be a director. So there are some standard probity requirements around that, which hopefully won't come as a huge surprise. So that includes not being an undischarged bankrupt, not being disqualified from managing corporations. You will need to have a director ID. If you don't already have one, that's quite a straightforward process. And surprisingly quick. And you will need to provide a current police check and a working with children check as part of the process. So I think Rowan's already talked a bit about the skills and experience that we've identified. So obviously member organisations can nominate whoever they like who's eligible, but we have tried to provide that information just to inform where we think we could really benefit from some additional skills. In terms of that's probably the gist of it in terms of eligibility and pathways. And I'll then move on. I don't know if there's any questions in the chat to be addressed, not that I can see at this point, but obviously feel free to drop them in there. I think Tanya's asked a question about paid members, if they're eligible. So perhaps the team might be able to speak to that one.
Sure, I could just quickly say, Tanya, we have different levels of membership. To be nominating someone, it needs to be an organisation that's a member, not an individual that's a member. So that might be what your question relates to. So there's a link in the chat to all the organisations who are our members. You need to be involved with one of those or go and talk to someone from one of those organisations, and they would then nominate you. Yes, they need to be financial members, but you don't need to be as an individual.
Thanks, Elizabeth. So I will probably move on to the next section that I was going to talk to you about, which is talking a bit more about CHF's funding, our independence and our policy positions. And so we are funded, as Rowan said, primarily through the Commonwealth Government, but we do get other sources of project funding along with membership fees and other specific sort of one-off activities. And so while the government funding obviously supports part of our work, it does not determine our policy positions. So we are independent, we're transparent about those funding arrangements and managing any risks that may occur through governance, contracts and internal controls. So our advocacy has been stated is guided by the evidence and consumer experience and our strategic priorities, and funding agreements obviously set out activities and deliverables, but they don't require CHF to adopt any particular policy positions in support of the government or otherwise. So we do play that role of providing independent advice to government, and that can include criticising policy when it's not hitting the mark and where we're seeing issues from a consumer perspective. And obviously that includes looking at how policy is implemented and system performance, and really just being that voice in the best interests of health consumers across Australia. So in terms of safeguards to protect our independence, as we've said, we do have strong governance processes around that, including our board oversight, conflict of interest processes, and a clear separation between funding arrangements and our policy positions. And we don't take funding from sources that we feel would compromise our independence or create unacceptable conflicts with our role as the national consumer peak. And so obviously this is all really important in terms of our credibility, because we need to be able to speak clearly and independently on behalf of health consumers. The final thing I think that is on my list to talk about is managing conflicts of interest. And as you would expect, and I'm sure many of you are familiar with these processes, we do have a policy, and conflicts of interest are managed through declaration, transparency and appropriate decision-making processes. So we as board members and staff and representatives are all expected to identify and manage conflicts as and when they arise. And the aim is not to pretend that we're never going to have a conflict, because obviously in health, many of us wear multiple hats, but just making sure that they're visible and transparent and managed appropriately, and obviously don't impact CHF's decisions or the perception of CHF's role. And so I think just to sort of sum all that up, obviously the key point is that we are really keen for strong nominations across the membership. And at the same time, we do want to provide that information about the skills and experience that the board has identified as priorities, just so that member organisations can take that into account when they consider who they might wish to nominate. So I'll stop there, and I'm just looking in the chat if there's any questions that have arisen in relation to that. There's a question from Basim: how can one be involved if you can't make it to the actual appointments? I'm thinking that might mean if you're not able to secure a nomination, are there other ways to be involved in CHF? Is that how you interpret that, Rowan?
Yeah.
Yes.
Maybe Elizabeth can answer that one. Might be a good space. Are you happy with that?
Yeah.
And I'll get Elizabeth, if you can manage the Q&A and tell align it to some of the panelists. But yes, maybe you could answer that question to start with. Yeah.
Do you want me to do that at the end in the Q&A or now?
Well, I'm up. I think we could actually start. Have you got anything? We've actually touched on everything we had to mention from that point of view. So I'm happy to go into, because we've talked about the time commitments. So I think it's probably a good thing to do the Q&A and just see if there's anything else that needs to be mentioned.
Sure. So I might just clarify, and then the board could make some comments too. So Tanya, we're, particularly for you, but others might have the same question. We're a member-based organisation. So our members vote for our board and our members decide who can be elected. And that means our organisational members. So there's a link in our chat. I'd encourage you to go and have a look and see whether you know any of these organisations, you've worked with them, or you're interested in them. They're the ones that have to nominate you. Now, sometimes member organisations nominate people that they've had very little to do with, but who come and meet with them and say, I'm really interested in this, I'd like to do this, would you be willing to nominate me? You don't have to be well known to an organisation, but you can imagine if they don't know you, it's a bit of a longer conversation than if they know you really well. If you're not involved in any organisations, I think, Basim, you were saying, so if I'm not going to be doing it this way, how else could I do it? There are many ways you can be involved. The team, I'm sure, will put up the link to our socials. So you can follow us on socials on Facebook or Insta and LinkedIn, which might seem like so what, but we do not have a massive marketing budget. So whenever we put something out, if you can like it or share it or send it to a friend, that is very important to us. So that's a really simple thing you can do. You can subscribe to our newsletter, find more about what we do. Almost every week we'll be asking, are you interested in this topic? We're running a webinar or a survey, or someone wants someone on a committee. And then you can say, yeah, I'd like to be on that committee that talks about access to healthcare in rural Australia, or I'm really interested in doing that survey on stigma in healthcare and transphobia, or I want to. So we do lots of things, and our socials chat, our website, and also our newsletter are really good ways to find out. We also have a consumer assembly, which is just about to finish because it runs for about a year. Soon we'll be asking for people to do that. All the work we do with consumers and when they attend meetings and so on is all paid work. So we don't expect you to do it for nothing, but you might decide you do want to come along to a focus group, or you do want to be involved in some other activity. So there are lots of things you can do. You don't have to be on our board to make a contribution, though of course this is about being on our board and making a contribution that way. I think Wayne's got a question. I might throw this one to you, Chair, just to give a sense of like, where are the meetings? Are they virtual? Are they face-to-face? How does that work?
Yes, so as I said, we try and probably have 1 to 2 up to 2 face-to-face at least per year. I think that contact, and also for strategy conversations, is very useful. The face-to-face meetings usually are a minimum of a day, can be longer sometimes if there's strategy being involved in that space. And we actually move around Australia to make it accessible, but also we take the opportunity to meet members in each state where we can and have a bit of a get together, say a lunch or a catch up while the board are meeting. So the example is our next board meeting is going to be in Brisbane, and we will meet and have a break in the middle of the day where the board and members can come in and meet the board and have discussions about things that might be important to them, and vice versa. So the meetings rotate around, but we also assist. Part of it is we pay expenses to fly the directors to wherever the meeting is going to be at CHF's expense. It's not that we do cover those sort of expenses. So and then the rest of the meetings are usually virtual, and usually they're going between 2 and 4 hour durations, depending on just how much needs to be sorted out. So that's sort of the commitment. Equally, with either of these types of meetings, it is really important to become prepared, having read the minutes, knowing, and the documentation that's been put forward, so that the discussions are and time is spent on discussing the issues, not making sure everyone understands and bringing everyone up to speed. So it's really important to spend that time and allocate enough time to reading and preparing for meetings as it is to be at the meetings.
Thanks, Rowan. There's a question I'm going to throw to you initially, Scott, which is from Rachel. And she's asking about, do you need to have done the AICD Company Directors course before you apply? And maybe you could give a sense of, the more governance expertise you've got, the better, I suppose. But what would you be wanting to see with the beginner? Perhaps they've been involved in associations or other things where they've had exposure to governance. What are good starting spots for those people that haven't done this before, and this might be the first time they come on a board?
Yeah, thank you, Edie, and thank you, Rachel. It's a great question. It's certainly not essential that you've completed the AICD course or gotten that qualification. It's a great qualification. If you have, then by all means, it is part of your a good part of your nomination to put it forward. But there are other courses. There's community directors do a diploma course in governance, which is also a good one. So there are a range of courses out there. None of them are essential or mandatory at all. It's a great question, Elizabeth, in terms of sort of the grounding experience. I think there's a really important distinction to be made, and you have made it already, Elizabeth and Rowan, between advocacy and government. So it's governance. So what your role is as a director of the organisation. It's not the same as being a consumer advocate. It's quite a different range of skills in governance and finance and each of those different places. So I think qualification one is enthusiasm and commitment to health consumers. I think that's where it starts. But in terms of, it would be great if you'd had some representation experience, if you'd been appointed to consumer engagement committees, for example, that sort of thing. So representation work is really important. But again, I say that because I think it helps you understand process and more formal processes just outside of straight advocacy. But yeah, so if you had some particular skills and experience in the governance of the governance sides of the member organisation that you're a part of, that would be a great point to draw on in your nomination. But yeah, I think it is enthusiasm, it is a willingness to commit the time and the effort, and it is a commitment to health consumers. If you have those other skills, if you have a professional background in technology, for example, or fundraising, those particular areas that we've identified as gaps, they'd be fantastic. But really, there's don't be discouraged from nominating if you don't feel like you've got the skills and experience that are required. That's quite an informative question, I think, Rachel, to suspect for a minute that you thought that the AICD qualification was essential. Really, for me, says that it's $10,000, I think, for that course for starters. By no means, don't for a second underestimate your potential as a CHF board director and speak with a full member organisation. If they're willing to nominate you, then please put your hand up, put your foot forward, your nomination forward, and see how you go.
Thanks so much, Scott. We've still got time for a few more questions, folks. So if anyone's got a question, now is your opportunity. We've got the board here at their leisure. You can ask them anything you like. I would just, it's a couple of admin questions people have asked. The meeting's being recorded, so we'll send you this link, which means you'll be able to watch it again and again if you, I don't know, maybe your Netflix subscriptions run out or something like that. So I think Christos and Fiorina asked about the slides. You'll get the webinar itself separate to the slides, so you should be able to go back and refer to things there. And the form also, somebody asked, I think we asked about the form for nominations. We will put that up on our website. We don't do it quite yet. The nominations open in about 6 or 8 weeks. So in a few weeks' time, we'll pop that up. Again, if you're following our socials or you're looking at getting our newsletter, you'll know, because we will say it's now up. That's probably the easiest way to know that that's available. I'm just having a look to see if there are any more questions. Yes, Wayne. So they can only come through a voting member, which is a full member. So we have 2 kinds of members. And I don't know if one of the board would like to explain the difference between associate and full members, or if you'd like me to do that.
I think if you go through it, I'll add to this in a minute.
Okay, you fill in my gaps, right?
Yep, yep.
So our constitution says we have 2 kinds of organisational members. Voting members have to be organisations like us. So, for example, Health Equity Matters and NAPWA, just because I've got you there, right, Scott? These are organisations whose primary purpose, like ours, is to reflect the views of communities and consumers, like carers. So if they're an organisation like that, they're our voting members. They're the ones that can nominate you. There are many other health consumer organisations. Last count, we had about 400 in Australia. Some of them are very particularly interested in a particular drug even only, or particular disease. Others have a broader remit. And many of them do not only consumer work, but also other things. They might be involved in clinical research. They might be involved more broadly in advocacy for particular products. They might be involved in developing national standards or guidelines. So those organisations are sometimes also our members, but they're associate members because their DNA is not consumers, it's more broadly health. So, for example, the Lung Foundation, the Heart Foundation, they are organisations that do a range of things in health, including a portion that relates to consumers. So they might be our associate members because they love our work and we love theirs, but they're not voting members because their board isn't made up of consumers as ours is. Consumers are not the members of the company and the ones that make all the kind of decisions around the board and so on. So we've got 2 different types. So I hope that helps Wayne and others. When you are looking in the list, you'll see there's voting members or full members. They're the ones that actually can do the nominations. And they'll be clear when you get the nominations form too. It'll say these are the organisations that can do that. And so again, I'd say the link's in the chat. You might be very pleasantly surprised when you go, oh, I know those people, or I know someone who's really well connected with those people. That's how I get involved. And if you're not sure, then you can always reach out to us and we can help you with that. Tanya asked about when the application's closed, Rowan, and I'm going to throw it to you because I know that Lyndon sent you the details of that. So they open in July, and I think you've got the actual dates. Do you want to run through those?
I'll find them.
Okay. I'll just do some tap dancing while you're finding them.
If you could.
Just imagine that I'm tap dancing while Rowan just flicks through her emails and finds the relevant email.
And the other thing I'll talk about also while I'm just doing that is I think that taking from Louise's note and just what Elizabeth's just been saying, don't leave it for months if you're really interested, to leave that conversation to contact a member organisation if you're not part of one, because that conversation could be quite in depth. They need to, if they're going to be wanting to nominate you, they need to be confident of who they're nominating. There may be a bit of work to work through with them, conversations, conflicts of interest and a whole lot of things that they need to square away. So that process in itself could take a bit of time. So don't leave it too late, I think is really important. Key dates. Okay, yes, I have got them. So what are we looking for? We're looking for the nominations to be open.
open and close, yeah.
Yeah, so the call for nominations are going to open on the 13th of July and they will close on the 10th of August. So it's not far away. Our AGM is actually in October. It's earlier than some AGMs, but it actually works well. And so we obviously constitutionally have to have our dates set up to meet that requirement. So between the 13th of July is where it'll go out and closure at the 10th of August. That's the time frame you have to get the paperwork in. So any relationship building needs to happen before that. Yeah.
So we should add, folks, we always get questions about this process every single year.
Yeah.
Because people think in other cases in a board, you just would put an application in, a bit like a job application in some boards. But in our case, you go via our members because of our governance and our commitment to our member base. So as I said, it's Rowan's given you a great explanation, and hopefully the other board directors have given you some confidence that you could definitely do this. Now it's to go and have a look at that list. If you're not sure, do reach out to us. We'll be happy to help you and tell you which organisations, but you'll need to actually then, make contact, talk to. My experience, or certainly what I've heard from most organisations, are delighted that someone wants to talk to them about these kinds of things. They may want to put someone up and no one's had the time or the energy, and they're like, yes, if you'd like to go, that'd be great. Come and talk to us about it. And then, you've got a couple of months to do that. Get that agreed, and also just do your own due diligence. Check us out as you have today. Have a look at what we're doing, see if you're really interested, and then you've got time to put in your application, and then the process decision is made in October. So then it takes a little while. It's a bit like buying a tax lotto ticket, but you don't know if you're won for 5 months. So you do have to have a bit of patience at the end. Now I can't see any other questions, so maybe I could just. You can just send it to we've got an info at, Tanya. You could just start there. There's info@chf.org.au. It's usually where I say start there and someone will redirect it to wherever it needs to go. It depends on your question. So that's a good thing to do. I thought maybe Louise and Scott and Rowan might want to have just one last word. I thought I'd ask you, what's the best thing about being on the CHF board? Like, why do you turn up as a volunteer to do this stuff? Just to encourage people. They're fully voluntary, Christos. We do pay, as Rowan said, if you need to go into state, you won't pay a cent, but we don't pay our board members any kind of honorarium. So I don't know, Rowan, do you want to start?
Look, I'll end it. So perhaps Scott's champing at the bit to answer this question. Come on, Scott, what makes you? What do you enjoy it?
That's very much overstating it, Rowan. But that was actually the question in relation to contacting CHF. By all means, I've answered a couple of the questions in text that have come through. Someone who is very committed to representing health consumers. Send your question in if they get directed my way. I'm very happy to talk to anyone who's considering nominating for the CHF board. Frank and honest, there are times of hard work being a director of an organisation like the Consumers Health Forum. It is, I think, again, I'll point out the distinction I made earlier and that Rowan and ED did about the distinction between governance and advocacy. So it can take time, commitment. It can be hard work at times, and it can feel like you're not directing your effort. If you're particularly interested in advocacy and hard advocacy, then it can feel like you're doing work which isn't contributing to that. But it absolutely it is. Good governance and good leadership at board level is essential to consumer organisations such as ours, and it's satisfying at the end of the day knowing that you've contributed your time, your energy, your expertise to an organisation like CHF. Is really rewarding. It's also a good group of people. It's nice to spend time with a group of people that are as committed to health consumer representation and advocacy as you are. So it's a collegiate board. We get along. There are, sometimes we don't agree on things, but that's never. It's disagreement which is highly principled and well-natured, and people there speaking their mind on what they truly believe the right ways to do things and what good governance is. So yeah, it's tremendously satisfying. Realistically, it's a commitment, yeah, and you need to be able to meet that commitment. But if you're up for it, we'd welcome you very much and support you into your role as a director. You're certainly not left hanging and thrown in and expected to swim a full stroke straight up. You will be supported. We're collegiate. We've all been there. We've all been new directors. So please, if you've got questions, get in touch. If you want to talk more, willing to do it, but don't think that you don't have the qualifications or the experience or the commitment to join the board. You've been committed enough to come along today, so we'd welcome your nomination.
Thanks, Scott. Louise, would you like to give your thoughts on that?
Absolutely. So echo what Scott said in terms of I came in, I'm relatively newer director, so came in about a year and a half ago. And it's been, a wonderful opportunity to learn from some of the longer standing directors, and it's a great culture. Some people who've really been in the trenches together at times. So that's been wonderful, and also have enjoyed sort of refreshing the board and adding new members to the mix. And look, I'd say CHF is the recognised national consumer peak. There's a reason that Elizabeth is often busy with media. We do play that really important role, and I think it's obviously a great privilege to support the work of the organisation, because we need it. We need it to continue to exist, and health policy in Australia would probably look quite different without CHF.
Thanks, Louise. And from my point of view, I've loved being part of the board. It's now coming up to, I think it's about 14 years or just over 14 years. And this is before we brought in better and more improved tenure space for board directors. And now you can only come in for a 3-year period, and then it's only extended by 2 times if approved and if voted in. It's really important to have that turnover and refreshing. And so I step away at the end of this year, and I know that I leave whilst it will be a fairly young board, it's actually a very strong board. In response to Scott's comment about we get on well together, we actually do. However, opinions and opposite opinions are very gratefully received in order to have very robust discussions, because if we don't unpack things and see it from everyone's point of view, it's not healthy. So from that point of view, we do come to a collective agreement. We have to, as a board, to give the Secretariat and the Executive a space to move forward. But it's more that we ensure that healthy discussion has all opinions aired, and I think that's really important. So I've loved being on the board, and I know that this year I'll be handing over to the board, and you'll be in a very good space. So that's great. Elizabeth, is there anything else? I've just got something I was going to say in closure. So if there's anything else you wanted to bring up?
No, there's no more questions.
No. Look, I guess the comment I just want to say is what's ahead for the CHF. And look, we've achieved a lot in the past 40 years, and I'm so glad I was able to stay till this 40-year celebration. I think that's great, and it'll continue into next year. Consumer voices are more embedded than ever before in health policy and service design, but it's not universal, and tokenism still happens, and many communities remain underrepresented, and I'm sure people all see that every day. The challenge for CHF now is to deepen our impact, especially in new areas of reform. And that means showing what good consumer leadership looks like, and holding the system accountable, and forming bold, values-driven partnerships. We need a strong strategic board to help guide that work. Very, very important. So I think that's where I'd like to leave today. Just say the next steps is all financial voting member organisations of CHS, as we've said several times today, can nominate candidates, for the election and vote in the election. The call for nominations will be coming out in the 13th of July. I can remember that now. And there will be formal notices. I would suggest that if you don't already get it, to actually sign up to receive the newsletter, because it keeps you apprised of what CHF is doing, but also these sort of opportunities. And in the short term, I want to thank you for your interest in being part of your interest in showing that you're interested in being part of the CHF leadership. And I'd like to thank everyone for attending today and hope you got something out of it. Thank you very much for attending. And there's information that just has the QR code, but all the contacts for CHF. So appreciate your time today, everyone, and thank you for attending. Bye-bye.